Good afternoon, everyone. I am Montgomery County Council President Gaywad Bunos and Chair of the Health and Human Services Committee. Joined today, as always, in committee by Council Vice President Glass, and I'm sure Councilmember Rice will be joining us momentarily. This Member Friedson, who is co-lead with me with full support from our colleagues on the first item we are going to discuss today. But we have two items for discussion on today's agenda. The first is to discuss a special appropriation to the FY22 operating budget for the Department of Health and Human Services for a pediatric mobile medical vehicle in the amount of $450,000. This would require an amendment to the FY22 operating budget resolution 19872, Section G, fiscal year 2022, designation of entities for non-competitive contract award status going to Casa Ruben Incorporated. The second item on the agenda, which we will discuss once we vote on that item, will be a special appropriation number 2268 to the FY22 operating budget also for the Department of Health and Human Services, ending the human immune deficiency joined this afternoon by Dr. Christopher Rogers, representing the Department of Health and Human Services and the public health team. And I First, we want to acknowledge the really terrific work of Dr. Peralta for many years, but in particular during the pandemic when she and a number of to our children, youth, and families. And she has been just an absolutely outstanding leader for many, many years. And her work is well known in our community. And she has also been engaged with our Latino Health Initiative and has been involved in the development of Por Nuestra Salud y Bienestar. And I really want to give a lot of credit to our HHS team, and in particular, Sonia Mora, who is not with us this afternoon, but as a former employee of the HHS department, working with Dr. Kroll and the entire team helped get that initiative off the ground. And we know that the need persists and that it is significant and that we must work collaboratively between both local government and our community stakeholders and leaders to be able to outreach. And so having mobile medical options and opportunities has never been more important than it is now. I once again want to give HHS credit. In this year's operating budget, they had requested and have received some additional capacity to carry out their own mobile medical practices, which will be important, and that help meet the needs of our community currently and right now. So this special appropriation also includes a matching grant, which is a tremendous opportunity and a way for us to leverage Precious County resources and expand our reach, which is, of course, in our taxpayer and our residents and constituents' best interest. And we also know the critically important situation as it currently stands on the ground with public health. And while things have improved dramatically, we are by no means out of the woods by any stretch of the imagination. So I'm now going to turn it over to Councilmember Friedson to make some opening comments as well. And I want to express my deep appreciation in working with his office on this effort, and in particular, Mary Geis, who's worked with the incredible Beth Schuman on my team to help get this initiative off the ground and coordinate efforts. So with that, I will turn it over to you, Councilmember Friedson, to make some opening comments.
Well, thank you so much for that. Thanks for your partnership and leadership on this. I will say that Beth, Mary, and Linda deserve all the credit on the county side, along with the work in collaboration with DHHS. But really, it's been a great effort to be able to work together. And just want to express appreciation to Dr. Peralta, to Tracy Friedlander, to Maria Gomez. And I think Sid Bressler is on with the Robert Shatner Foundation, which is making this possible. This is a dollar for dollar match, and really shows what we can do when we do public-private partnerships with our nonprofits. I think we've had a foundation of that before the pandemic. We doubled down on it during the pandemic, and it really is the model and the path forward. And I do want to credit the health department and DHHS for their willingness to do these types of partnerships, because I really do think, as we talked about the other day, when we're providing services, making sure that it's on the turf, in the language, in a culturally competent way with our community, that it's accessible and reachable, and that we're not leaving anybody behind. And we can't do that with government alone. We have to do that in partnership with community-based organizations. And this really is a perfect example of that, and wouldn't be possible without the level of collaboration and coordination that we're having here. So thank you so much for that. Really excited and looking forward to moving this through, and just very grateful to have a community that is so invested in giving back and in lifting up every community within it. So thank you.
Thank you so much. And thank you for mentioning Sid, who's, we so appreciate his leadership as well, and the Shatner Foundation for their willingness to step forward, which is so important. So what I'm going to do now is turn it over to Linda McMillan to establish some context and background. And I'll also note that all of our colleagues have unanimously signed on to co-sponsor this important special appropriation. But I will note one thing. It is a little unusual for the council, especially these last 2 years, to have issued the amount of special appropriations that it has. But we've done so in partnership with the executive branch to meet this moment, because we know that our residents have been in just critical need. And so this has been an important opportunity for us to be able to get information and much needed services to the community in the quickest time possible. But this is not a practice that we will sustain moving forward, but especially given the opportunity for this match, it made so much sense for us to be able to move this forward now. So, and given the need. So I just wanted to put that asterisk because it has been noted by several of our colleagues, understandably, expressing some concern generally, not regarding this specific appropriation, but just generally that it's always more, it's a better function for us to do this as part of the normal budget process. But given opportunities like this, we can't pass them up. So with that, Ms. McMillan, I'll turn it over to you to make some comments, provide some context, and then I will turn it over to Dr. Kroll to make some comments on behalf of the executive branch, and of course, Dr. Peralta to talk more about the work that she envisions that will be carried out through this important fund. The last thing I'll mention before turning it over to Linda, this is Linda's last session, everyone. She is officially, literally her last session. And so, my God, we're gonna miss you, Linda. But this, I think, is the perfect project for you to end on, with an idea that kind of came out of left field from a couple of council members. And you, as always, shepherded us through this process, connected important dots, and leveraged the relationships that you've been able to build with HHS and other executive branch agencies over many, many years to get us to this point where we can all feel very comfortable and confident in this particular initiative, because it's got Linda's fingerprints all over it, which is the best possible thing. So Linda, thank you so much. We acknowledged you more formally a couple of weeks ago, but just this being the last committee session, you're going to be with us. I just needed to make those comments and embarrass you just one more time. So with that, Ms. McMillan, I turn it over to you.
Thank you. And I actually just want to say there's no committee I would rather be with on my last day than to be with the HHS committee one more time. So thank you. So you've really given a lot of background on this. It is a $450,000 special appropriation to the Department of Health and Human Services. The county's money would be funding the mobile clinic vehicle, the wrap, and the equipment that goes with it. The Shatner Foundation is generously putting forward a match, which will go to Casa Rubin, that will fund the operations for this mobile clinic. And so it is a unique opportunity and partnership. And I did just want to say a couple of things that you've really already mentioned, but in the memo, I did want to highlight that this does continue the county's work. The county has these long-standing efforts with the African American Health Program and the Latino Health Initiative and the Asian American Health Initiative, as well as the ones we've had to put in place during COVID for Nuestra Salud and the African American Health Program, COVID Response and Black Physician Network. And so this really works on to continue to address disparities. In an earlier racial equity assessment that you received from the Office of Racial Equity and Social Justice related to grant funding that the county was receiving on vaccinations, it highlighted information from the Kaiser Family Foundation that talked about populations, particularly Hispanic and Black parents and populations, not being able to get vaccines from trusted places, believing they may have to pay an out-of-pocket cost, having difficulty traveling to a vaccination site, or needing time off from work to get a child vaccinated. And these were all reasons that were given for reasons why vaccinations might not be received by some in our community. And of course, the county's working very hard to reach everyone in our community. And so I would just say that the initiative that has been put forth has three main objectives, which is to improve vaccination rates among children and youth from birth to ages 21, to provide developmentally appropriate primary care evaluations for children and youth who have missed their routine health care examinations, and to address social determinants of health and linkages to care to youth from birth to age 21. You did have a public hearing on Tuesday. You did have 5 people who testified, and then you received more testimony from many county residents in support of this effort. I do want to highlight that also at your Tuesday testimony, you received testimony about the importance of these kinds of flexible services for people in the disability community. And so that was very interesting testimony to have in addition to those communities that we have been focused on getting outreach to. And so I think that I would turn it over to Dr. Peralta to talk about. There is some information that's in the memo from their proposal about the demographics of those they expect to serve, the targets areas they expect to serve. But I think that the other issue that the committee may want to just discuss with DHHS and Dr. Peralta and others who are here today is the collaboration that will go on in terms of targeting areas, both for this service through this mobile clinic, but also to make sure that we're connecting people to primary healthcare homes through our programs like Care for Kids and Montgomery Cares, because we all have the same goal of really wanting to get people access to healthcare homes where they can have their healthcare addressed in a regular setting and not have to wait to go to an emergency room or wait to have to go to an emergency clinic, but really to keep up with their healthcare. And I think Dr. Peralta and Dr. Kroll and Dr. Rogers can all share their thoughts with you about that.
So I'll just say some words since Linda called on me, but I am just honored to be able to lead this organization and enter into this public-private partnership, focusing on complementing the health disparity work that is already happening in our county, and with a specific focus on addressing children and youth needs. We know historically, we know the data, we know the CDC data too, of what happened during this historic pandemic. And the goals are really crafted and focused on what is not only doable, but also what is the enter of many of these communities, right? It's through going to the community, accessing them, and at the same time offering the services and linkages that they need. So this public-private partnership, again, is just complementing the health disparity work that we are very proud of in the county, and the collaboration with the health department and with the blessing of the council. I think we are ready to do the work.
Thank you so much, Dr. Peralta. Dr. Kroll?
Sure. Good afternoon, everyone, and happy to be with you all again. I think I've said from time to time that there is a reason that there are banks and grocery stores now, and the reason is that that's where people are. It's where people go, and so we put services in keeping with that. We have put services, and we put services where people are and where they're accessible, where it's within easy reach, and hopefully where it's a natural part of their everyday lives, so they can reach rather than have to make an enormous extra effort to get to those resources. We have been, to your comment, Councilmember Alvarez, about special appropriations during the pandemic. The council and the county executive and everybody has worked remarkably well together to get things done quick, fast, and in a hurry as we've needed to do that. We are coming out of what looks like the most significant wave of this pandemic we've had to date. But we're not done yet, because we know that there is a lot more that needs to be done, both in terms of vaccination and testing and other resources. But this is going to be a long-term recovery process. And so we're going to continue to need to do things out of our normal sequence for some time yet, I suspect. The need is continuing. We did an equity survey, an equity analysis early on, and created an equity framework that would allow us to do exactly what we're talking about today, and that is to take resources to the communities where they're needed. Our whole minority health initiative has been geared and tailored to take vaccination and testing capacity and case management supports to communities that we knew would be underrepresented in the vaccination effort. And we saw that from the early days of vaccination. So this is an important piece of the work that we've done. And we're proud of the work that we've done. We also know that there is still a lag in our communities of color, and there's still a gap for a variety of different reasons. Even our Salud, Hiv and Sti initiative, and our Black Physicians Health Network, who are trusted partners, who go to those communities, who reach in, are seeing a lag, which tells us that there is still more work to be done, and that we have to dig deeper into the community. Dr. Peralta's offer and proposal comes at a judicious moment, because we know we still need the help, and we're going to need more support into those communities for the foreseeable future, not just for vaccination, but for immunization and for other kinds of health needs that our children are going to experience in the coming years. The other thing about this is that we have always partnered. We've always been in partnership with the community. We could not possibly have accomplished all the things that we've accomplished in the last 2 years without enormous partnerships and collaborations across the county. So the fact that we now have Casa Ruben, the Shatner Foundation, partnering with HHS and the community is a winning combination, I think. So we are looking forward. We are looking forward to that. And I think our goal, and we'll get into the conversation on this, but our goal is to certainly make sure that we are doing this in coordination and in tight concert with each other, so that we are not duplicating efforts and not wasting efforts, and we're going where the support is needed as we look forward. So with that, I will turn it back over to Ms. McMillan, I think, or to Councilmember Alvarez. Happy to be here today.
Thank you so much, Dr. Kroll. I've got Council Vice President Glass who'd like to speak, and then I have a couple of quick questions that are pretty straightforward, but Council Vice President Glass.
Well, good afternoon, everyone. This is a really great conversation and a great reason that we're all here. And maybe I should start by saying that, I'm willing to filibuster as long as I have to keep Linda McMillan still in this committee, if that is an option. I'm not necessarily known for filibustering, but if that's what it takes, Linda, I'm all for it. Yeah, okay. So in all seriousness, Dr. Peralta, thank you very much for your presentation and for everything that you and Casa Ruben have been doing, going through the packet and seeing the incredible work that you've been doing for years, and most recently the 7,000 immunizations given to kids. I mean, that's fantastic. And we knew that, and we still know that has been a little harder than our adult population. And so the clinic, the mobile clinic, and all the other outreach activities are exactly what the doctor ordered. And so thank you for fulfilling that. Tracy, thank you for helping connect all of us and making sure that county government and local government really connects with the services and the needs and the people doing that work. So thank you for having your ears to the ground, whether it is here or helping refugees and other parts of the globe. So thank you. And I'll also do a shout out. I'm not sure if anyone had mentioned it, but clearly the collaboration and the partnership here is also because of the Robert I. Shatner Foundation. And so gladly the county putting up these funds being matched by another foundation, which I've gone to their website and see that they support a number of really good organizations here in the county. And that is a foundation I am not personally all that familiar with, but on doing that cursory look, they're doing great stuff and helping some really great organizations. So thank you to that foundation. I'll just really close because I'm sold, right? We're all sold on this and the importance of it. I appreciate the way that you've presented it and the 3 objectives for doing this work, right? And helping, with the vaccination rates of the youth, which clearly you've already been leading on with the 7,000 shots, and then providing the primary care evaluation for those who have missed their routine health. And that is something that we in this committee talk about all the time, how we continue expanding healthcare for those that need it. And Montgomery County has been, I think, a national leader in terms of local government doing that work, but we recognize that there are still gaps and we have to go to the communities and meet them where they're at. And that's what the mobile clinic will absolutely do. And then just the holistic approach to making sure that all members of the community, and again, quite personally, the members of the LGBTQ plus community as well, I appreciate that being a demographic that you look out for and that you help. And so I'm glad that we are here helping you to keep all of our residents and particularly our younger residents healthy and safe. So thank you, and look forward to getting this out the door as soon as possible.
Thank you so much, Council Vice President Glass. I just had 2 quick questions, and I know the answer to both, but for our public and also just to make sure that you have the longest possible runway to be able to get this off the ground effectively, Dr. Pedazda. We know vehicles in general are hard to come by right now because of supply and demand issues that are out of anyone's control. But you have already given some thought to how in a transition we could get a vehicle. If you could talk a little bit about that and what the plan is to actually purchase the vehicle, again, given the challenges in the market right now for anybody trying to sell their used car, they know what I'm talking about, but that would be helpful.
So thank you so much. And again, my appreciation to the Department of Health, to the council members, and definitely to the Shatner Foundation, because putting together all these resources is what make things happen. For that reason, I have outreach to our collaborators, some of them are here in this call, to make sure there are no gaps in implementing this very important project, because we know that vaccinating communities in needs is not easy, not only because all the barriers that we saw, but also because we have to adapt to them, adapt to their schedule, adapt to where they are, and also obtain consent. Remember, we are treating minors. So for that reason, we are collaborating, and thanks to the Shatner Foundation and to Maria Gomez, we all came out with the idea of collaborating with Mary Center to be able to have a vehicle, and partnering with Casa Ruben to be able to start. And one of the beauty of this is not only we are partnering with them, we also joining forces to be able to address some of the very challenging aspects of providing care to young people, for example, teen pregnancy, some of the GBLTQ, etc. So we, with that partnership, not only are using the vehicle, accomplishing the 3 goals, but also we are providing other services that Mary Center is willing to do in the same band. So this is an incredible opportunity, and is also bridging the gaps in the best way possible at an expedited way, the same way that you have done it for this project.
Thank you so much, Dr. Peralta. And I know the answer to the next question too, but for the dozens watching at home, I'm channeling my inner Gracie Rivera oven here. I know that the Up County, of course, has had a myriad of needs, and they've been so ably represented now on his last year by Councilmember Rice. But wanted to confirm that there will be some geographic diversity to the locations that you intend to address, and that it's not any just one specific geographic location, but you're going to go where the need is, regardless of where that is in the county. I know the answer to that, but just wanted to confirm.
Absolutely. The North Star of this project is the community needs. And we, as we know with the health department, we will continue to evaluate where the needs are, but the collaboration with the Uptown Hub is critical in all that area to make sure that we provide the services that are needed, especially in populations who are just coming to us, right, arriving. But historically, the nature of our work is community-based and to help ensure that those people who are missed are found and connected to care. So we will be there. And this is the reason why strong collaborations can make this stronger for all of us. And the fabric of Casa Ruben has been basically collaborating and making sure there's no duplication of effort.
Perfect, perfect. Thank you. Well, those were my only two questions. I think we had discussed a lot of this during the initial introduction, and the packet is perfectly put together. So most of our questions have already been answered before we even started this session. Just last two thoughts. Want to once again thank HHS for their nimbleness and flexibility and their embrace of this wonderful opportunity and this partnership. And we do look forward to checking back in a year from now or so on progress and where things stand and what more we can do to help this really terrific work. So with that, can I get a motion to move forward this special appropriation?
So moved.
Moved by Councilmember Rice.
Second.
Seconded by Councilmember Glass. Let's do this one with a hand vote. All those in favor, please raise your hands. And that is unanimous among the committee. And of course, Councilmember Friedson would raise his hand if he could, but he's not on this committee. But we know where he stands, and that this will have the support of our colleagues. So Ms. McMillan, anything else to add on this one?
Just to say that it will be scheduled for action on your consent calendar on Tuesday. So it'll be on for action on Tuesday.
Wonderful, wonderful, wonderful. Well, thank you all so much for joining us this morning, which takes us to the second item on the agenda today. And that item, pulling it up, is the special appropriation number 2268. This one is being staffed by Ms. McGuire. So Ms. McGuire, I will turn it over to you to give us some background and context in this special appropriation.
Pardon me, thank you. And this is a special appropriation to the Department of Health and Human Services for federal funds. And so I do just want to highlight that this is a grant of federal funds. It does connect to the Ending HIV Epidemic Grant. And so one of the reasons that that's coming to the committee today is so that the committee can receive a very brief update and overview of the existing efforts that are going on in the department related to that federal initiative of ending the HIV epidemic, and how these specific grant funds will relate and integrate and align with that existing work. So we'll have a brief overview, and then this particular appropriation, if the committee approves it, would be scheduled for April 19th.
Thank you. Dr. Kroll, Dr. Bridgers, I'll turn it over to you.
So I'll turn this over to Dr. Bridges just momentarily, but except to say that this comes at a timely moment. Like many of the problems and challenges we faced throughout the pandemic that predated the pandemic, the HIV rates and the STI rates have continued to be a significant challenge for us in the county. So this is a moment to try to reboost our efforts as we come out of the pandemic. So I'm looking forward to having this funding in place so we can expand and grow our work. So with that, I'll turn it over to Dr. Bridges.
Good afternoon. Thank you, Dr. Kroll. Good afternoon, President Albornoz, Council President Albornoz, Vice President Glass and the committee members joining us this afternoon. I'm going to turn it over to Ms. Emily Brown, but I just want to recognize today as being Transgender Day of Visibility and just highlight the support that we continue to provide in our LGBTQ plus community through engagement, education, and treatment. We know that when HIV levels are low, undetectable levels means untransmissible levels. And so we continue to work earnestly. We've done great work. I've invited the entire HIV/AIDS program team here because I wanted you to hear their voices today in response to the funding. Ms. Brown, I'll turn it over to you. She's prepared a very detailed PowerPoint presentation explaining the work that we've done using general fund and grant funding. And so this is an indication of all of the great work that we continue to do in our community. So without further delay, Ms. Emily Brown.
Thank you so much, Dr. Bridgers. And I just want to confirm that I'll be sharing slides from my own screen. Is that all right with y'all? Okay.
You should be able to, yes.
Yep. Just give me 1 second. All right. How does that look? Can you see just my slide?
Yes.
Fantastic. Okay, I want to say thank you so much to everyone here, and especially acknowledge the members of the council who have been really willing to participate in our plan to end HIV in the community, getting tested in public, tweeting about it, getting self-tested when we opened our self-testing initiative last year, and sharing that information with your constituents, President Albornoz, in English and Spanish. So thank you so much for your actual personal involvement in this. And I want to acknowledge my fellow team members here, our Senior Administrator of CD&E, Kimberly Townsend, Sam Dutzman from our budget team, who is here to answer questions related to fiscal matters, and my colleague and fellow program manager, Carol Moen. So I just wanted to give you all an overview of how this money that you're talking about today relates to the bigger picture of our Ending the HIV Epidemic initiative in the county, and an overview of how all this kind of slots into our 5-year plan, which is actually more like a much longer than 5-year plan to end HIV, but in a good way, I hope. So our goal at the federal level, and the reason that this program was conceptualized, is to reduce new HIV infections in the United States by 90% by 2030. And it's a targeted initiative looking at jurisdictions like Montgomery County that carry the largest burden of new HIV infections in the United States. So here in our region, DC, Baltimore, Prince George's County, and Montgomery County are all together in being chosen as ending the HIV epidemic priority jurisdictions. So we work very closely with each of those jurisdictions on a number of initiatives because epidemics don't have borders. And to make a very long story of collaborative planning very short, we got together with a lot of different stakeholders in the beginning of this initiative and created a 50-page plan to end HIV that I will send folks to read, but I know that many of you have at least seen the executive summary. It's not the most compelling of reads after about page 13. But the 4 pillars of work are to diagnose all people living with HIV as early as possible, to treat people living with HIV. Thank you, Dr. Bridgers, for that shout out and mentioning that when people are successfully treated for HIV, they cannot pass the virus to others, in addition to living long, healthy lives. To increase prevention, new interventions like pre-exposure prophylaxis, PrEP, and syringe exchange programs. And lastly, to up our public health response to HIV, looking at clusters, outbreaks, and disease investigation. So it's a 4-point plan. And confusingly, and you know, it's not something we talk about to the general public just because it's a lot of bureaucracy here, to be frank. The federal funding comes to us in Montgomery County from 2 different sources that fund different parts of this work. So the CDC funds our diagnosis, like testing and prevention activities, through the Maryland Department of Health, and HRSA, through the DC Department of Health, funds our treatment and response activities. And so this is our plan in one slide through a fiscal lens, really, and our strategies on the diagnosis and prevention side, which it pains me to see them oversimplified like this, but we are working very hard right now to scale up routine screening in healthcare as recommended by the CDC since 2006. Increase testing outside of healthcare settings, so in non-traditional settings, just like Dr. Peralta was talking about, and shout out to Dr. Peralta for being an HIV expert, and it's so clear that how she talks about health, she has an HIV lens because HIV has such huge equity implications, and our HIV epidemic in Montgomery County lives at many of the intersections that that she was talking about today, including adolescence, which is really important, and really her work is HIV prevention work for sure. So we are working to scale up partner notification. A big piece of our work, which I'll talk about in a little bit of detail, is improve access to healthcare for LGBTQ plus members of our community who have long reported lower levels of access to healthcare. And increasing awareness about HIV still existing, about sexual health in general through a public campaign. So that's through our CDC side. On the treatment and response side, which you're focused on today, but they're all related, as Dr. Bridges mentioned, to develop a countywide linkage to care guideline so that everyone anywhere diagnosed in the county, all the clinicians involved in that situation, whether it's a hospital at 3 o'clock in the morning on Sunday or a primary care clinic Monday morning, has a clear path to public health services so that we can perform partner services and all the public health activities that we need, in addition to linking them to high quality care, which we do offer for free here at Dennis Avenue Health Center if someone's uninsured. We've established a data to care program, which means we're using public health data to actually inform, to find and link back to care people who are lost to care for HIV, expanding access to social services for people living with HIV to make sure they stay in care, building treatment capacity among clinicians to make sure that every clinician in Montgomery County has access to the latest information about HIV, streamlining health insurance navigation, which is hugely important for people living with HIV, and increasing awareness of treatment and HIV in 2022 through a campaign. So as I mentioned, we're talking about this side today, but it's so helpful to bear in mind that this is all connected. So we have clearly, as y'all have been involved in quite publicly, made a lot of progress on treatment and response pillars. And we have onboarded a new epidemiologist. So I'm not going to go through this line by line, but because y'all have the budget, just wanted to show some collateral from our campaign embedded in there as well. We've onboarded an epidemiologist focused completely on data-driven HIV and STI initiatives in the county, an accompanying social worker to support the wraparound services that people need to stay in care. We have a new public health advisor focused completely on the data to care program, which is huge. And we are able to use this funding combined with CDC to create the first LGBTQ inclusive comprehensive sexual health campaign in the county. And that is out there, the Do It For You campaign. On buses, on social media, metro stops.
I'm sorry to interrupt really quick. Councilmember Rice's Wi-Fi went down, so he's trying to get back in on his phone, but Equin, you may not recognize the number. If somebody's trying to get in, it's Councilmember Rice. So if you could let him in, that would be great. Thank you. So sorry, Emily. Let me.
Oh, that's okay. Would you like me to wait for Councilmember Rice?
No, you can keep going.
Okay. So as Dr. Bridges mentioned, and as Dr. Kroll mentioned, the COVID-19 pandemic has, of course, taken precedence and sidelined some of our maybe in-person activities. It certainly has taken some mind share away from clinicians, but we've been able to leverage a lot of virtual opportunities to build capacity for clinicians in the meantime. We've found a lot of clinicians who have a lot of stake in HIV prevention in their practices that we did a rolling symposium last year, and we're doing another symposium for primary care clinicians this year in the May-June area called Pride in Sexual Health as part of our Pride programming. And but importantly, I wanted to highlight that we are, whenever we can, doing events with community partners that are not doing HIV-related work, but who are working with communities that are particularly vulnerable to HIV. And one example that, again, the council members, many of y'all attended, which was great, is our World AIDS Day Health Equity Breakfast in December in collaboration with the Montgomery County Alumni Chapter of the Delta Sigma Theta sorority. And that event was all about highlighting the massive racial disparities in our epidemic, in our HIV epidemic, which is, of course, a worldwide problem, but talking to communities about health equity, leaving that part of the conversation out makes this a lot less interesting and a lot less effective. So We are, lastly, just because this is in the budget, I think it's important, doing everything we can to innovate our medical record keeping systems to streamline care for people living with HIV, and to make sure that when we test someone for HIV, we have the technological wherewithal to get them and their information into care in a way that is easy and convenient. So we're doing a lot with NextGen, our EMR system, to make sure that we're collecting required data, but also doing it in a way that increases or improves the patient experience. So moving to our prevention and diagnosis pillars, because these are probably the more visible parts of our work in the community. We have added, we've actually completely built an outreach infrastructure from the ground up through this funding, which is super exciting. And we've hired an outreach coordinator, an HIV linkage to care public health advisor, and obviously a program manager, that's me, to oversee the related activities. On the ground, we're working with Montgomery Cares clinics on a project to scale up routine screening, again, as recommended by CDC in healthcare settings. We have an initiative underway with Safeway Pharmacy to distribute free in-home self-tests in high incidence areas of the county. And we're really rewriting all of our HIV testing protocols to improve access to PrEP for anyone who tests negative for HIV, but who's likeliest to contract HIV in the county. So we're really excited about that. And we do offer PrEP here at Dennis Avenue Health Center for free, regardless of insurance. And we're really hoping to reach more people with PrEP. And a really exciting advancement this year is going to be the expansion of our HIV and STI services. Of course, you all have heard that we have some pretty high STI rates, and that COVID has caused a not well understood yet increase in STIs throughout the US. We're no exception. And so we really need to expand STI services to other parts of the county. We are expanding to Up County Regional Services Center this fall. We're onboarding a registered nurse, a phlebotomist, and an office manager, all as Athena brokers. But we are hoping to make those into term positions for sustainability purposes eventually. That would be super helpful. And ordering a lot of supplies, kitting out that space that we've been offered, which is great, with all of the state-of-the-art STI HIV prevention supplies that we need. And we'll be able to serve some of our folks living with HIV up in that clinic as well, with laboratory services and social services as well. And lastly, I just want to mention that in honor of National HIV Testing Day and Pride Month, we will be hosting our second annual Pride in the Plaza festival and series of events focused on LGBTQ plus health through an intersectional lens. In Montgomery County and elsewhere, HIV disproportionately impacts LGBTQ communities of color. And there's not a lot of brick and mortar activity around LGBTQ health and wellness in the county. So we wanted to create a space and bring folks together to really prioritize that and also integrate sexual health services in the meantime. So it's an ongoing effort. I know that Councilmember Glass's staff members were on our kickoff call for Pride in the Plaza, much appreciated. And we are very excited to have a very full week of events this year for Pride in the Plaza. Just wanted to give a shout out to our team at Dennis Avenue Health Center, second floor HIV and STI services. We do provide free and low cost HIV medical care and case management services to people living with HIV and their families. HIV testing and treatment. We have an HIV dental clinic. We, as I mentioned, offer PEP and PrEP at the location, and peer support services, social services, housing, et cetera, for people living with HIV. And as always, of course, referrals to county services. I was planning on stopping here unless you all want to continue to HIV related data in the county. Always happy to talk about it, but I want to be respectful of your time.
Thanks, Emily. Yeah, why don't we give some highlights just to sort of give a snapshot of where we are right now, and then we can go to the Q&A after that. We've got until about 2:30, so we've got about 15 more minutes. Oh,
fantastic. Okay. Usually my fast talking is a bad thing. So I just wanted to give you all, and if you attended our World AIDS Day update, this data may not be new to y'all, but just kind of a baseline of where we are with our goal of getting to 90% reduction in new HIV infections, and kind of some attributes that you call them problem statements, but again, it's kind of where we're starting from in the county. Montgomery County has, an average of, well, 150, 130 new infections over the past several years. And then we saw a huge reduction in 2020, of course, related to COVID-19. And of course, a reduction in new diagnoses certainly does not indicate a reduction in new infections. There was a huge reduction in testing during that time, of course. But here's our goal of 16 new diagnoses in 2030. And our vision is of course, to be a county where new infections are extremely rare, and whenever anyone's diagnosed, making sure that they have everything they need to stay healthy. But we got to start testing people earlier. So in Montgomery County, 1 in 9 people living with HIV don't know their status. It takes about, it takes 7.5 years to diagnose someone with HIV in Montgomery County. And a third of our folks are diagnosed late. So you will see us over the next several years working with our healthcare partners and other social services partners to incorporate testing into as many places as we can, because 7.6 years is, that's a lot. And we are unfortunately leading the state in late diagnoses for HIV. So we have a lot of work to do in getting to people on time. And it's just a matter of renormalizing HIV testing in healthcare, right? Because if someone goes 7.6 years without getting tested and diagnosed, they're going to be pretty sick when they get to us, and they often are very sick when they get to us. So that's our testing goal. We also have a lot of folks who are out of care. So that's the rationale for our Data to Care program, and which is working with the state with surveillance data to find and reconnect to care anyone living with HIV in the county. And that is a lot of what do you need to get back into care? Do you need housing? Do you need food support? Do you need a support group? Are you experiencing stigma, discrimination? Really addressing those root causes of the reasons people drop out of care. And as Dr. Bridgers mentioned, those folks who are out of care, who are not virally suppressed, we want to make sure that they're back in care both for their personal health and for the public's health. And then finally, PrEP uptake has been really low across the board everywhere. Montgomery County is no exception. In fact, we actually have a relatively high rate of PrEP uptake compared to some of our neighbors. So, we would like to really be finding folks who are likeliest to contract HIV and making sure they know PrEP exists. It's still really not out there in the public enough. That's part of our campaign as well, making sure that everyone knows it's an option. And this is just a daily medication that HIV negative people take to prevent HIV. We now have an injectable form of PrEP as well. So lots of technology on the market to support these efforts. And to me, EHE, ending the HIV epidemic, has been about sort of retooling a lot of things that have been going really well and are really stable here at HHS, but just taking that to the next level and reminding our community that this is still an issue, and that health equity is at the center of all of that.
Emily, thank you so much. Your passion and energy and knowledge of this is infectious, and so we really appreciate your leadership. I enjoyed participating last year in the testing strategy and tweeting about it in Spanish and English, and look forward to doing that again whenever you want me to, and whenever that'd be helpful, because we have to get the word out, as you noted. I'll just tell a quick story. I was thinking about this as you were speaking. This marks the 25-year anniversary that I did a study abroad program in Mexico City when I was in college. And I worked for an organization called Casa Alianza, which helped reintegrate homeless and runaway kids with their families. And one of the first cases that I was assigned to was supporting a social worker who was charged with finding the mom of a 16-year-old girl who was at Casa Alianza who was dying of AIDS. And she had a 7-month-old baby girl who was HIV. And we went all around the outskirts of Mexico City to locate her mom. It took us a while because, these were in shanty towns, no addresses. We finally tracked her down, and, I'll never forget that experience, because in addition to the despair of finding out that we had found her daughter, but she was dying, we then had to explain what AIDS was and what an HIV positive diagnosis likely meant at that time for her granddaughter. So that experience was the seed that planted my interest in public service. And here we are 25 years later, while we've made great strides on many different levels, we know we obviously have a long way to go. And this disproportionately impacts our Black and Brown community, and in particular women, and our LGBTQ plus community, obviously as well. And so we have to keep our foot on the gas, both in terms of education, engagement, program offering. And I think the stigma to a large degree has been diminished, but it's not been eliminated. And so there's still a lot more work left to do. So thank you for that presentation. I've got Council Vice President Glass, followed by Councilmember Rice to make some comments. Council Vice President Glass.
Thank you, Mr. President, and thank you for sharing your own personal story towards public service and public health. I appreciate that, and I'll start by reiterating what Dr. Bridger said before. You know, it's Trans Day of Visibility, and clearly the point of this conversation and of this appropriation and the work that we're doing is to let everybody know in the LGBTQ plus community and their allies that we see them and that we support them. And that is the significance of this day. So don't know if it was timed that way, but it is certainly timely. And Ms. Brown, thank you for all of your work. I am remiss that I was not able to attend the Pride in the Plaza last year because I had other Pride events that were going on. But the beautiful thing is that since I arrived at the council 3 years ago, there are more and more events. And this is fantastic. And so I have already told my team to cordon off the Pride in the Plaza event to make sure I'm there. I saw the various posts and videos and was absolutely impressed with the diverse celebration that you and your team helped put on. And so I look forward to attending that and all the other events later this year. But the very first Pride event that I held in the summer in June of 2019, when I first organized Pride and my office did, we actually organized an event at Denizens in downtown Silver Spring, and we helped raise awareness and helped raise funds for Us Helping Us, which is a nonprofit organization dedicated to HIV prevention and outreach for Black men specifically. And so again, the nexus of this conversation with the recognition that the council president Albornoz just noted that the HIV epidemic these days disproportionately affects men of color and women of color as well. And so anything that we can do to continue getting that outreach, continue the education, and continue destigmatizing this situation so that people get the help that they need when they need it on the front end. And so I appreciate all of these efforts. And this appropriation clearly is incredibly important. The one question I just had in the few minutes that I know we have left, Ms. Brown, you mentioned that over the last 2 years, because of the COVID pandemic, other healthcare needs and other testing was not done at the levels that were required or that we wanted. How has that affected our population here? I know you mentioned that it is a national problem, and completely understand that when so many other healthcare needs were put on the side burner. But are we starting to see, as people, any increase in detection or spreading of HIV or any STIs because people are now getting tested and going back to get general health care?
Yeah, that's a great question. So first, I would like to say, because I'm not sure this is generally understood, that both of our clinics here, our HIV clinic and STI clinic, have been open throughout the pandemic. So certainly because many people living with HIV are immunocompromised, there was I've seen a couple of studies about this nationally. I certainly think it's true here as well. There was a lot of reticence to come to in-person appointments. Some rudimentary telehealth really helped with that in the beginning. And we have seen, we've been at capacity for most of the pandemic. People who are getting STI screening have continued to come in and get it here. It's just that it's just never enough. It's never enough with STIs in the county, which is one of the reasons we're expanding. But what I will say about HIV, and something that's extremely important, is that a lot of what people living with HIV everywhere get help from is each other, right? And support groups and connecting socially. And isolation is correlated with really not good health outcomes for people living with HIV in particular. And stigma is a big reason for that. So being isolated from other people living with HIV, discontinuing in-person support groups out of just regard for public health, has been really difficult regionally and of course nationally. So we can connect people living with HIV to national networks online. It's not the same. And I think one of the things we're really excited about is getting our in-person support groups back up and running, because it's a lot for our folks to not have anyone to talk to about that one thing in their lives that they can't talk to everyone about. So that's a big deal. But we have been open the entire time, and we absolutely have seen an increase in some STIs, and we expect an increase in diagnoses after people start coming back to full testing levels.
So something we're certainly going to have to monitor. Yeah, Dr. Bridges.
Council Vice President Glass, I just want to add, as Ms. Brown indicated, our services stayed open throughout all of HHS, but principally our HIV STI services. But as Dr. Kroll indicated, we had the equity framework embedded in our vaccine strategy so that we could continue to provide equitable access to those individuals who were immunocompromised. I know that Councilmember Rice provided some updates, and we reached out to Food and Friends to make it accessible and to be able to include that type of responsiveness to our community. So I just wanted to add that.
Yeah, no, I think that's brilliant and so needed to be able to utilize the other resources that so many of these residents are utilizing, whether it is Food and Friends or any other types of social service agencies, and crossing that information so that it gets to them multiple times, right? It's basically advertising about our services in all these different areas. And so I'm really glad to hear that you all are already on top of that. And I know that that will continue once we increase these services through this appropriation. So thank you for your work. Thank you for this information. And I look forward to celebrating Pride with you all in June. So thank you.
Thank you. Councilmember Rice.
Well, thank you very much, Council President. And let me just jump right in by saying that I think that part of our solution is going to be working with our physicians. I will never forget when I had my first HIV test, and it was, my doctor had said, oh yeah, so we're doing a battery of tests for your physical. Do you want to add and do an HIV test? And I said, well, I don't think I'm HIV positive or anything like that. And he said, oh, okay, well, you don't have to do it. I just wanted to make sure that it was provided to you as an option. And it's interesting because when I most recently had my last physical, my new physician told me, and she said, Craig, look, you're 49 years old. My birth date is public, and said, they changed the guidelines for colonoscopies, and you need to get one because they switched it from 50 to 45. And so you should get one. And I said, well, I don't know. I don't have a history of colorectal cancer in my family or anything like that. And she said, no, you should really get it done. It's really important. And because of what she said, I got it done. And it really is one where I think that we need to ensure that our physicians are taking HIV seriously to where they are really saying and suggesting to everyone that they should get a test just to level set. Just to let them know that at this date certain, I was HIV negative and was able to move forward. And Emily, I participated as Council President Albornoz did in doing this testing. I grew up in a time, when it was scary to get an HIV test because you didn't want to know about a fact that you might have what we assumed back then was a death sentence. I remember the day when Magic Johnson came out and said that it was in 1991, it was the year after I graduated from high school. And it said that he was HIV positive. And everybody's like, oh man, Magic is gonna die. And this is so sad. Here we are 30 years later. and Magic Johnson looks fantastic on all kinds of commercials and everything else. It really is one where I think that folks need to understand that early detection does matter, as you highlighted, Emily. But that doesn't happen if we don't have everybody who continues to commit to get testing. We have had so many people who have gotten tested via COVID, and now this mindset of testing is upon us. This is the great opportunity. And that's why I love this investment so much that we're putting forward, because this is a great opportunity where folks are more mindful of their overall health and well-being, that this is the time to seize that moment and say, and oh, by the way, as you're getting tested for all these things, as you're getting back into the doctor's offices after COVID, make sure that you understand your status and that you know where you are when it comes to HIV. It's just incredibly important. And so I look to, when we build out our Black Physicians Health Network, especially, and the great work that's being done with Por Nuestra Bienestar, that we make sure that we're highlighting these testing models that we know are going to be so incredibly helpful. And they're so easy. I mean, it's something that can be done in the privacy of your home, let alone if you went to, one of the myriad of different testing places that are all across the county. So it really is one where I just wanted to say that, because I think that our doctors play a key role here in terms of helping to normalize the testing of HIV. And I think that our doctors have come a long way in terms of recommending and suggesting that you get tested. But I think that, again, there's so much more that we can do, especially in our communities of color, to make sure that we continue to normalize knowing your status. So thank you, Mr. President.
Thank you, Councilmember Rice. All right, colleagues, we have a special appropriation in front of us. I think we can do this one by acclamation, supporting the staff recommendation for the special appropriation. Seeing heads nod, so that is unanimous. Anything else, Ms. McGuire?
No, thank you very much.
Great. Thanks, everybody. My lights are flickering because of the wind, so we'll see how it goes. All right. Thanks, everyone. Bye.
Thanks, everyone. Stay safe. Take care.